Before we begin, I'd like to state that the Oakworks table, the Prolux Oakworks table, has been invaluable to me as a practitioner. I work many times 8 to 10 hours a day in my clinic, and I find that having a table that allows me to reduce the height and increase it as I needed it has really been instrumental in allowing me to continue as a massage therapist for the past 20 years. Let's begin with the first point. I'm going to show the actual points identified. I'll give you some landmarks which will help you to understand where they are. The very first one that we're going to be pinpointing is below the clavicle, sternum, manubrium, and this particular point lays right at the very end of the rib. Now, these points will be very tender in most individuals that have been diagnosed with fibromyalgia. Now, if we go back to our whole postural distortions, if the person is having a forward head posture and is exhibiting a forward head posture, these muscles tend to be more hypercontracted. Your platysma, your scalenes, and many times the shoulders may rotate forward, again, to cause this particular area to be hypersensitive. So correcting those postural deviations in those areas are very, very important. Another 2 points, and they're on both sides, okay, another 2 points that we have to be aware of is the point here at the lateral epicondyle. And let me just state that the points for fibromyalgia that they have been identified are on the origins or the insertions of muscles, or they actually come at areas of bony prominence. And in this particular case, we have this particular point here that is near the lateral epicondyle. And people who work with their hands, you may find that this particular area will be more tender. She has an identical point on the other side. So we have sternal points, we have the lateral epicondyle, and we also have a point at the medial portion of the knee. Now we'll move down into the medial aspect of the knee and show you where those points are located. We have the medial border of the patella. This particular point is medial and superior to the patella. And we have an identical point on the other side. Now we've gone over the points for the sternum, the lateral epicondyle, and also the 2 points on the knee while in the supine position. And now we're going to turn our model over and start on the other side. Earlier I talked about the importance of cervical posture. And if the head is very, very far forward into a reverse cervical curvature, there are spinal nerves that will be impinged. As the person's head goes further forward, they have a tendency to tilt their head back so they're not looking at the ground. When that happens, these cervical nerves are impinged. So we want to take a look now at the other points on the back side of the body. There are 2 very, very distinct points in the lower part of the occiput. You can see them marked here on the lower part of the occiput. These particular areas are closely aligned to the area that there would be some type of impingement or hypercontraction by the suboccipital musculature. So we want to be very, very thorough in our overview of the posture of the individual. The next 2 points that are in the cervical region, we have 2 in the upper cervical, lower part of the occiput. Here is the bottom of the occiput here. We've got 2 that are located on the lateral aspect of the transverse processes. It's actually where the posterior tubercles would be located around C5. This in this particular area to avoid any pressure against the transverse processes. So this is why I'm going to recommend to you that you attend a class to make sure that you are thoroughly trained in how to release these particular points. The next 2 points are in the middle part of the trapezius, and you'll find that this is extremely tender in many people. that are working with their arms and hands. So you've got 2 points there. And then you have a point here at the insertion of the levator scapula. And you have a point, identical point on both sides. Spine of the scapula, fall off the lateral edge, and right there we've got our point. Again, spine of the scapula, lateral border, fall off, and we've got our point. Remember that the tender points are located at the insertions or origins and many times bony prominence, and this is one very, very good example of just that. So we've got upper cervical, we've got the mid to lower cervical points, we've got the trapezius points, and we have the levator scapula. Now, as we move further down the body, there are 2 points that I'd like to point out, and I've thoroughly drawn these. Here's your crest of the ilium. These points are at the very top of the ilium. And you'll find someone that has a hyperlordosis or a sway back, that these areas will obviously, the musculature will be shortened, so thereby these points may be tender. So you have an identical one on both sides. Now what I'd like to do is to use the bolster system by Oakworks and have our client lie sideways on our side lying position so that we're able to see the last of the 2 points. It's helpful to have the person on a side lying position, and here I'm using the new system by Oakworks on the side lying bolster system to treat the last 2 points. These points are located near the attachment of the piriformis on the trochanter. And you can see here that this is our point. Again, this is an area that may be very tender. The person has lateral flexion of the leg. It can be an area that's obviously very tender, just naturally. These are tissues that are typically not palpated. Therefore, I would suggest that before going in and just palpating these particular points, that you learn the proper release technique for that particular routine. There's an identical point on the other side. Clients who have been in my office who have had fibromyalgia diagnosed tell me that besides having a regular massage and body work done, structural body work in particular, and tender point release therapy, tell me that they benefit most when they sleep. They actually get enough sleep every night to make sure that they're getting those 3 very, very important layers of sleep that we need to have our body replenished and heal our muscles. The other thing they've told me is that by drinking clear fluids, staying away from neurostimulants, things like coffee and tea and alcohol and nicotine, those are things that stimulate the nervous system, an already stimulated nervous system. They tell me that planning their day for the next day is a good idea, to give themselves time for each segment of things that they want to do and not try to just throw everything together in one day and try to accomplish everything. That they need to turn to a system of relaxing and taking time for themselves throughout the day. I would suggest that from personal information is that a course in yoga can help you to slow down, to teach you how to breathe, how to stretch, and how to relax. Another thing that would be very helpful is a course in meditation, learning how to just have positive affirmations surround your day so that you can move forward. Another thing is research has actually shown, there's a tremendous amount of research out here that shows that positive emotions actually increase the endorphins which reduce pain. And it also helps us to strengthen our immune system. So positive emotions, having humor in our lives. And there's one thing that we are truly in control of, and that's our attitude. And that's the only thing that we can go throughout the day, no matter how good or how bad we're feeling that particular day, is to go about it with the right attitude. To see one thing we truly are in control of. If you're interested in finding out more about fibromyalgia and the seminars that we offer, visit us at www.thetherapyoption.com or send me an email and let me know how you're doing at thetherapyoption@verizon.net. Thank you.